Hello and welcome. Today, we're diving deep into a rare and complex kidney disease at C3 glomerulopathy. This condition affects the glomeruli, the tiny filtering units in your kidneys, and can lead to serious health consequences. Let's unravel the intricacies of C3 glomerulopathy together. The precise cause of C3 glomerulopathy is still not fully understood, but it's considered an autoimmune disorder. This means the body's own immune system mistakenly attacks its own tissues, in this case the glomeruli in the kidneys. This attack is often triggered by abnormalities in the alternative pathway of the complement system, a crucial part of our immune defense. These abnormalities can be genetic or acquired, leading to overactivation of the complement system and its deposition in the kidneys. Now let's explore the pathophysiology. In C3 glomerulopathy, the overactive alternative complement pathway leads to the excessive deposition of C3, a key protein in the complement system, within the glomeruli. This deposition triggers inflammation and damage to the glomerular structures. Over time, this damage impairs the kidney's ability to filter waste products from the blood, leading to proteinuria, the presence of protein in the urine, and hematuria, the presence of blood in the urine. In severe cases, it can progress to kidney failure. C3 glomerulopathy is considered a rare disease. Its exact prevalence is difficult to determine, as many cases may go undiagnosed or misdiagnosed. It can affect individuals of all ages, including children and adults, but it's slightly more common in younger individuals. Understanding the true scope of the disease is a challenge, but ongoing research is helping to improve diagnostic accuracy. The signs and symptoms of C3 glomerulopathy can vary widely from person to person. Some individuals may experience no noticeable symptoms in the early stages, while others may develop more pronounced signs. Common symptoms include proteinuria, detected through urine tests, hematuria, which may cause the urine to appear pink or reddish, edema, or swelling, particularly in the legs, ankles, or face, and hypertension or high blood pressure. As the disease progresses, individuals may experience fatigue, nausea, and loss of appetite due to impaired kidney function. Diagnosing C3 glomerulopathy involves a combination of clinical evaluation and laboratory tests. A urine test will typically reveal proteinuria and hematuria. Blood tests will assess kidney function and complement protein levels. The gold standard for diagnosis is a kidney biopsy. A small sample of kidney tissue is examined under a microscope to identify the characteristic C3 deposits in the glomeruli. Genetic testing may also be performed to identify specific gene mutations associated with the disease. C3 glomerulopathy can be further classified into two main subtypes: dense deposit disease, also known as DDD, and C3 glomerulonephritis, often abbreviated as C3GN. These subtypes are distinguished based on the specific appearance of the deposits observed in the kidney biopsy under electron microscopy. In DDD, the deposits appear as dense ribbon-like structures within the glomerular basement membrane. In C3GN, the deposits are more granular and less defined. While the underlying pathophysiology is similar, these subtypes may have slightly different clinical courses and responses to treatment. The treatment of C3 glomerulopathy is primarily aimed at controlling symptoms, reducing inflammation, and preventing disease progression. Medications such as angiotensin converting enzyme inhibitors or ACE inhibitors and angiotensin receptor blockers or ARBs are often prescribed to lower blood pressure and reduce proteinuria. Immunosuppressive drugs such as corticosteroids, mycophenolate mofetil, and cyclosporine may be used to suppress the overactive immune system. In some cases, eculizumab, a monoclonal antibody that blocks the complement pathway, may be considered. Ultimately, the treatment plan is individualized based on the severity of the disease and the patient's response to therapy. Currently, there are no proven methods to prevent C3 glomerulopathy, given the complex and often idiopathic nature of the condition. However, early diagnosis and prompt treatment are crucial to minimize kidney damage and slow disease progression. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may help support overall kidney health. The prognosis of C3 glomerulopathy varies considerably depending on the individual. Some individuals may experience a relatively stable course, while others may progress to end-stage renal disease, requiring dialysis or kidney transplantation. Recent research is focused on developing more targeted therapies to inhibit the alternative complement pathway and prevent kidney damage. Clinical trials are exploring novel agents that can specifically block complement activation and improve outcomes for patients with C3 glomerulopathy. Continued research holds promise for better understanding and treatment of this challenging disease.